chatting about the autonomic nervous system now. And so autonomic nervous system controls visceral activities. We good on that? Just that statement. Okay, it's visceral activities. Organs like unconscious activities, right? Something that you cannot voluntarily control. It does have reflex arches. It does have, sensory input. It has motor output. But the point is, you cannot consciously control these activities. You can be aware of them, but there's no control over them. And so it receives sensory inputs from visceral organs and changes the activity of visceral organs in response to those signals. And the word autonomic means self-governing. Okay? There are multiple differences between autonomic and somatic branches of the nervous system. And we're going to talk about those differences. I mean, there are functional differences, of course, fundamental functional differences, conscious versus subconscious. But there are many more smaller, more fine, smaller differences that lie not only in physiology but also in the anatomy of those systems. Let's recall what the somatic system does. First of all, what is the motor output of the somatic nervous system? What kind of effectors are in the somatic nervous system? Somatic nervous system, what kind of effector does it stimulate? The skeletal muscle, period. Okay, skeletal muscle. Neuron, the motor neuron is myelinated, heavily myelinated. Why is it heavily myelinated? I hate to ask why questions. Okay, let me rephrase it. Say again? Not just easy, fast. Your skeletal activities should be fast. Going back to the reflexes. If you step on something sharp, you want your leg from that sharp fast. Does that make sense? Are we clear? Awesome. There's only, so pretty much it's like one neuron, right? It goes all the way from the CNS, from the spinal cord, correct? To the effector, which is skeletal muscle, and it releases acetylcholine. And that's it. Does that make sense? That's it. And that final neuron always stimulatory. It always releases acetylcholine. There's no option to hyperpolarize. There's option to release and not release. Do you understand what I'm trying to say? Think about your skeletal muscle. Think about it. Two things that you can do with it are relax and contract, right? That's it. And essentially, relaxation is the lack of contraction. Relaxation is the lack of stimulus. That's it. Okay? Do I understand that? Okay. Now, what about autonomic? The motor branch consists of two neurons. Okay? In parasympathetic system, you have pre-ganglionic and post-ganglionic neurons. And that's first concept that's different from autonomic. You have pre-ganglionic. What does that mean from the standpoint of English language? Pre-ganglionic. Before the ganglion, right? So you have a neuron that goes from central nervous system to the ganglia. And in the ganglia, it's synapses with a postganglionic neuron. Does that make sense? Are we clear? Parasympathetic system, again, you have preganglionic neuron, which extends from CNS to the ganglia and synapses with postganglionic neuron. We clear? Postganglionic neurons extend all the way down to the organ that they regulate. Does that make sense? Few other differences. First and foremost, the axons of preganglionic neurons are lightly myelinated. Postganglionic neurons are non-myelinated. What does that mean regarding the transmission? It actually always, it's slower than somatic. And it's slowest in postganglionic. It's not that, the point is it's, go ahead.
No, I mean like it's faster getting to
Ganglion? Yes.
At the ganglion, and then it's slower actually getting to the muscle itself.
That's correct. That is correct. And overall, it's slower than somatic. Does that make sense? Do you understand? Question?
Yeah, like so for the somatic, it's myelinated all the way through, so it goes from the actual.
The soma?
Yeah, from the soma all the way, but it does not go all the way to the muscle itself.
The neuron?
Yeah.
It goes all the way to the muscle.
All right. So here's the break.
Here's the good. That's good analogy. Here's the break. So this is one-step transmission. Somatic one. Autonomic is two-step transmission. Preganglionic, ganglion, postganglionic. Does that make sense? Which makes pretty much autonomic transmission is pretty slow. Is that fine?
For the muscles it controls, yeah.
Say again?
For the muscles that the autonomic system controls, yes, it's fine.
Which muscles does autonomic system control? Smooth and cardiac, right? No skeletal muscles are controlled by autonomic reflexes. Smooth and cardiac. Is that okay if your heart rate increases in a span of like 5 seconds? It's fine. No, it's fine. Think about what I'm trying to tell you now is your skeletal muscle responses must be really quick for your survival. Does that make sense? If I'm throwing something at you, you want to evade it as fast as you can. Right? When you exercise, it's okay if your heart rate goes up in few seconds. Your skeletal muscle response is a matter of milliseconds. Seconds or maybe minutes, fine, it's okay. Autonomic responses are slower, but they also are lasting for a longer time. Right? Neurotransmitters. All kinds of them, we're going to talk about them. I just kind of overview, not only ACH, but also norepinephrine. Does anyone know the old word, the old term for adrenaline? Yes, norepinephrine used to be called adrenaline. Okay. Does that make sense? And you can see the effectors of autonomic nervous system. Smooth muscle, cardiac muscle, and glands. Like pancreatic gland, for instance. Does that make sense? So far, because we're going to go back to that scheme and, we're going to chat about exactly, the length of the neurons and neurotransmitters produce the different steps. We're going to come back. We're going to take it slow. Does that make sense? So, two divisions of autonomic system, parasympathetic and sympathetic. There are major differences between them. First and foremost, functional ones. Parasympathetic system performs housekeeping, energy conservation functions. Which system is active in you right now, mostly? Parasympathetic. You're relaxed. There is no serious activation of anything. There is no serious excitement going on. Sympathetic system, its function is to mobilize the body, mobilize the systems of the organism. Okay? When we say during activity, it means practically any state of excitement, from fear to happiness. Okay? It means exercise. Any physical activity involves activation of sympathetic nervous system. Does that make sense? Now, if you would look at the picture on the right side of the slide, you will notice that these two systems, they control practically same organs. There are some differences, little differences, like skin. There are also metabolic functions. Metabolism and various skin structures are controlled exclusively by sympathetic. We'll get back to it. But in general, you can see that, for instance, heart has both sympathetic and parasympathetic innervation. Make sense? Does that make sense? That both systems control the same organ. Now, this control is usually exerts opposite effects. Think about this. When you are excited, what happens to your heart rate? It goes up. When you're relaxed, it goes down. Sympathetic system increases heart rate, parasympathetic decreases heart rate. We good? And that will be like in general. For instance, when you are sitting at the dinner table and you are about to start eating and you're really, really hungry, what happens to your mouth? How does this saliva look like? Huh? Clear and abundant, right? And liquidish. Now imagine you have to make a presentation. Dry, and saliva is produced, but it's really thick. Okay? That's sympathetic stimulation. We will talk about why it is thick. It's actually quite fascinating. Okay, but you see opposite effects. Much less saliva, it's much more thick and viscous. And that's going to happen practically with every organ. Okay? Parasympathetic stimulation, if parasympathetic activates something, sympathetic will deactivate, inhibit, and vice versa. Does that make sense? Not only this, well, obviously, you know, the great example of body running smoothly is the heart. It's probably the greatest example of cooperation between sympathetic and parasympathetic. When you are sitting in your chair, reading the book, what's your heart rate? 64, 65, 70, ballparkish. Does that make sense? Your heart at this moment, when you're sitting all relaxed, is under parasympathetic control. Your parasympathetic system keeps your heart rate down. Say you stand up and start walking around. What happens to your heart rate? It goes up. Parasympathetic stimulation decreases, 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 and at some point it goes away. That makes sense? It's about 100, 120. And then sympathetic kicks in and starts to increase your heart rate. That makes sense? So this dual innervation allows the smooth transition from, you know, inactive to active state. Low activity, high activity. Does that make sense? Good. Moreover, in any sort of activity, any sort of response, like organismal response to the stimulus, it's going to be both somatic and autonomic. Think about physical exercise. Okay? When you need to, I don't know, run, your skeletal muscles, are they involved? Of course, you're running. In order for them to be able to contract, they need increased blood supply. So that's going to be a sympathetic stimulation of the heart, increased cardiac output, vasodilation of blood vessels in the muscles, constriction of blood vessels everywhere else. Okay, so it's going to be multiple responses. Go ahead. It's no problem. Okay, the question, I'm going to tell everybody. The question is, when you work out, when you do exercise, do you promote generation of new capillaries? Capillaries don't go to the heart, but generally when you exercise, and especially when you do resistance training, your muscles, including cardiac muscle, will produce angiogenic factors that will promote growth of blood vessels. So if your muscles become bigger, new blood vessels will be produced. If they don't, then no. Okay, yes?
In relation to that same question, is there a way to prevent hypertrophy?
Of the heart?
Yeah, like when you work out heavy.
Yes. Hypertrophy of the muscles?
Yeah, like how do you prevent the hypertrophy for the heart?
Let's talk about this question right after the class, okay? And if anybody interested, you can listen. It's just separate occasion, okay? Absolutely, we'll discuss it. So you can see that any somatic activity, skeletal muscle activity, will immediately stimulate autonomic changes. Does that make sense? Now, parasympathetic. We're going to talk about parasympathetic first, sympathetic second, compare two systems, do some physiology. So, often a parasympathetic system is referred to as rest and digest. When you have a meal, after that, you usually don't go exercising. It's probably a bad idea. You just want to stay relaxed, Kick back, read a book, watch TV. Make sense? So it means active digestion. So this parasympathetic system stimulates the digestion, stimulates it. Okay. Parasympathetic system decreases the blood pressure and heart rate. Now you have to understand, when we say decreases, it's normal. Okay? So your normal resting heart rate is, say, 65. That's parasympathetic system that keeps it low. Okay? So don't use too much energy. Pupils are constricted. You're reading. Okay? Glands are accommodated for close vision. And eventually, since it stimulates the digestive activities, fecal matter is ready to be eliminated, and urine is ready to be eliminated. That makes sense? So where do they originate, those fibers, the parasympathetic fibers? Brainstem and sacral region of the spinal cord. There are 4 cranial nerves that carry parasympathetic fibers. It's oculomotor, facial, glossopharyngeal, and vagus. We'll talk about each of them separately. Okay? Now you can see, that pre-ganglionic fibers Let's trace one of them. So preganglionic fibers will go from, say, brainstem to the ganglion, or sacral region to the ganglion. Does that make sense? Can you see the ganglia? This is ganglion, this is ganglion, this is ganglion. Ganglia is the place where preganglionic fibers synapse with postganglionic fibers. Is that clear? Where are those ganglia of parasympathetic system? They are either very close to the target organs or inside the walls of the target organs. Does that make sense? So this shows you very well, you know, inside the wall, inside the wall, inside the wall. Considering this, considering that ganglia are either very close to the target organ or in the wall of the target organ, what can you say about relative length of preganglionic fibers and postganglionic? Which ones are longer? Preganglionic are long, postganglionic are short. Does it make sense? Good. So that's, any questions on that part of anatomy? So know where they start, brainstem, sacral region. Preganglionic fibers are long, postganglionic are short. And understand the activity. I will ask you about this. Okay, like, which of the following activities is associated with parasympathetic activation? Now, the function. So we're going to talk about nerves. We'll start with oculomotor. That's cranial nerve 3. And it controls smooth muscles of the eyes. Okay? Originates in the midbrain. Synapses in the ciliary ganglia. Now, which unconscious activity do you think oculomotor nerve controls? You can stop blinking. It's a reflex, but you can stop blinking. Pupillary constriction, yes. So response to the light. Does that make sense? What else? There's another structure in the eye. We didn't talk about it. Also in the eye, also unconscious. Oh, movement of the eye is totally conscious. You know, you can look. Huh? Say again? Well, that's, yeah, but what I'm talking about the activity that you cannot possibly, like, voluntarily, consciously control. Focus, yes. Oh, no. Color perception has nothing to, it's totally sensory part, okay? So we've got pupillary constriction and lens accommodation, okay? Pupil and lens. That makes sense. Now, facial nerve controls, first of all, nasal and lacrimal glands. What do they produce? Lacrimal glands. Tears, nasal glands, mucus, snot, right? Facial, in this case, parasympathetic fibers, they stimulate production of mucus in the nose and they stimulate production of tears. Okay? Salivary glands. submandibular, and sublingual. Sublingual gland produces the most of your saliva. Okay, so when you are hungry and you are at the table, you produce a lot of saliva. Does that make sense? That's your parasympathetic activation. Okay, same goes for glossopharyngeal. You can see glossopharyngeal. It's going to be number 9. Okay, parotid gland. Another salivary gland. So facial and glossopharyngeal together will stimulate all 3 salivary glands. Sublingual.
For the thicker saliva, isn't that coming from the submandibular? No?
It's different. So, okay, let me finish with sacral nerves, and I'll explain why when you are excited, saliva is thicker. Okay. Now, sacral nerves are pretty simple. Okay, the sacral part of the spinal cord, they go to the organs of pretty much, well, lower abdomen and pelvis, which means reproductive system and colon, well, lower colon, rectum, sigmoid colon, rectum, urinary bladder, all organs that are here. Now, what is the function of urinary bladder? Hold and expel, right? Peeing. So stimulation of urinary bladder means you're gonna pee. What's the function of sigmoid colon and rectum? Expulsion of feces. Stimulation of smooth muscles in the sigmoid colon and rectum. That's sigmoid colon. Sigmoid colon, that's rectum. Okay, will expel feces. With the parasympathetic stimulation of reproductive organs, it's actually quite interesting. So what happens, that stimulation leads to the erection in males and engorgement of clitoris in females. That's parasympathetic stimulation of reproductive organs. We're going to talk about the unique feature of reproductive organs when sympathetic and parasympathetic systems, they work together. Not opposite, but together. Different functions, but together. Okay? Saliva. What is saliva? What does it consist of? What does it consist of? What is saliva? Water. Okay. First and foremost, water. Huh? Say again? Germs? No. When it is formed, it's absolutely sterile. When it comes into your mouth, then it acquires germs. When it is formed, it's totally sterile. So water, most and foremost, there's a little bit of protein mucin that makes the food sticking together. A little bit of like antibodies, lysozyme, a bunch of stuff. Okay, but most and foremost, water. Where does this water come from? Yes, it comes from blood. Make sense? When you produce a lot of saliva, like when you're about to eat, saliva is really liquid, really fluid, which means, what does that mean in relation to water content? It's higher, it's watery, right? When you're about to give a speech and you have that thick mucus, thick saliva, water content is lower. Remembering that water comes from the blood, what does that tell you about the blood flow to the salivary glands? Lower blood flow when you are nervous, when you have sympathetic stimulation. So what happens? Sympathetic stimulation constricts the blood vessels that go to the salivary glands. Blood flow decreases, less water goes into the saliva, it becomes thicker. Does that make sense? So those three nerves, oculomotor, glossopharyngeal, and facial, control, as you can see, glands and smooth muscles in the head. Smooth muscles in the eye, that's oculomotor, nasal, lacrimal, and salivary glands, that facial and glossopharyngeal. Does that make sense? Sacral nerves, well, they're at the bottom, they control some stuff at the bottom. What controls the rest? The rest is vagus nerve. Vagus nerve contains about 90%, it's a pretty big number, of all parasympathetic fibers. Okay? It's a pretty big nerve. Sorry. And it forms plexuses. We've already run into plexuses before. Remember the plexuses of spinal nerves? Cervical, brachial, lumbar, and sacral plexuses. Same concept. So fibers all crisscross, merge, separate, and those plexuses innervate practically all organs in the thoracic and abdominal cavities. And the names of the plexuses are self-explanatory, honestly. Like cardiac plexus, innervation of the heart. Pulmonary plexus, innervation of the lung. Celiac plexus, innervation of the stomach. Okay? Superior mesenteric, which is pretty much here. Upper, what's the word? Intestine. Upper, well, it's going to be not only transverse, it's going to be small intestine, because anatomically, transverse colon, small intestine, so both jejunum, ileum, duodenum, they all pretty much at the same ballpark. They'll, well, yeah, they're not like at the same level, but if you would look at the lady and gentleman right there, you can see the light stuff, it's the small intestine, especially the gentleman to like farther from you, you see the intestines, right? The brown is the colon, it's a large intestine, and the like beige is the small intestine. So if something innervates transverse colon, it's going to innervate the small intestine as well. And you can say by the name of the plexus that, celiac, it's probably going to be stomach and a little bit of a small intestine. Hypogastric, liver, pancreas, okay. Superior mesenteric, small and large intestine. Does that make sense? Good. What do you think? There's a procedure called vagectomy. You can cut the vagus nerve. Sometimes you have to. Not the whole thing, but part of it. But imagine that you have someone, and person, gets vagectomy, like here. What's going to happen to the person? No. What is? Wait a minute. That's a good. Say. Go ahead. Nerves above it. Well, no. You just stop the transmission. You just stop the transmission of motor output to organs. What does parasympathetic do to the heart rate? It brings it down. So if you cut the nerve, what's going to happen to the heart rate? It's going to go up, right? What's going to happen to the digestive activities? Huh? Constipation. Yeah, it's going to decrease. It means constipation. Well, in case you're Dr. Mengele and you're Nazi and you decide to, make person's life a hell, then you cut it really up. In some cases, partial vagectomy happens when when you do the heart transplant, you have to cut all the nerve supply. Does that make sense? You can't like really like reattach the nerves. So in patients who receive heart transplant, their heart has no parasympathetic innervation. So they're going to have normal heart rate at 100, 120. Go ahead.
So, like, is that why so many of the heart transplant patients, they also have pace rate?
Maybe, probably so. But right after the transplantation, they have like 100, 120. Unless there is a pacemaker, as Jacques said. Because pacemaker can actually imitate the parasympathetic rhythm, the normal sinusoid rhythm.
We had a cardiologist. He would not want to be called for any of the patients, like any of his heart transplant patients, unless their heart rate got up to 160.
That makes sense. Yes. Now it makes sense, right? That's pretty common. And that's, look, this is the part, it's a little neat factoid that I told you now, but for you, you go into the actual work, you go into the cardiology ward, and you walk into the room where the patient is, patient that just came back from the heart transplantation procedure, and you see 120, and you don't freak out. You say, nah, it's fine. Dude's supposed to have it, because there are cases when like nurse jumps out and yells, this guy has heart rate of 120, he's going to die like every minute. No, it's fine. Does that make sense? So we're talking about anatomy so far, and before we move to sympathetic. Parasympathetic is fairly simple. You have brainstem, 4 cranial nerves, you have to know them, and you have to know what they innervate. Okay? I always tell you, I'll be explicit on what you have to focus on. Don't focus too much on the ganglia and those nuclei, really. But I want you to know precisely, like I ask you, which of the following structures are innervated by facial nerve? And you tell me, nasal glands, lacrimal glands, sublingual, submandibular, salivary. You got it? That you should know. I'm going to ask this. Are we clear? Cool. Sympathetic nervous system. Same. Innervates visceral organs. Okay? It has certain unique functions. Okay? One of those unique functions, skin muscles and skin glands. Which muscle do you have in the skin? Well, muscles. You have smooth muscles in the skin. Do you remember? Erector pili muscles. What do? Erector pili. Make your hair stand up. Yes. So those are stimulated by sympathetic system. Think about this. When you are frightened, your hair goes up. Right? Skin glands. Sweat glands are stimulated by sympathetic nervous system. When you exercise, what happens to your sweat glands? They produce sweat, so you get sympathetic stimulation when you exercise because you produce so much heat. Make sense? Also, sympathetic system increases cellular metabolism. We'll mention it again. Okay. So sympathetic system has certain unique functions. It stimulates erector pili muscles. It stimulates sweat glands and other skin glands. And it increases cellular metabolism. Okay? Are you keeping up? So where does it start? Sympathetic pre-ganglionic fibers start in the thoracolumbar region. Essentially, it's from T1 to L2. We clear? So preganglionic bodies are in the lateral horns of the spinal cord at, level that you're talking about. So you look at any like T1, T2, T6, T12, lateral horns contain sympathetic neuronal bodies. Does that make sense? Now in the sacral area, there are no lateral horns because there's no sympathetic, only parasympathetic. And now, where do they go to? So if you would look at this image, you see that preganglionic fibers extend to so-called sympathetic trunk. Can you see the sympathetic trunk? This structure has many names. Sympathetic trunk, paravertebral chain of ganglia, paravertebral sympathetic trunk. It's just, the point is, sympathetic trunk runs along the spinal cord. You don't see it on the model, but it runs along the spinal cord, very close to it. And it's essentially a chain of ganglia. You can see on this picture here, you can see the spinal column, okay? And you can see the sympathetic trunk, 1 and 2. They are symmetrical. You have sympathetic trunk on the left side of the column and on the right side. Is that clear? That makes sense? That's... No. They both sympathetic trunks. Does that make sense? Mm-hmm.
So it's sympathetic on both sides.
Yeah, so on this picture here, it shows only one side, but it's on both, okay? So you've got spinal column here, okay? And you've got two sympathetic trunks on each side of it. Does that make sense? Because that's symmetrical. Spinal nerves are symmetrical, so trunks are symmetrical. Does that make sense? So if you would look at it, we're kind of running a little bit ahead of the train, but if you would look at it, you will see that the preganglionic fibers, they go to the sympathetic trunk, and then postganglionic fibers go to the organ. What can you tell about the length of the fibers? Which ones are shorter? The preganglionic is shorter, the postganglionic are longer. Does that make sense? Now, how does that work? Now this is pretty heavy anatomy, and I want to spend as much time as we need to understand the preganglionic fibers, how they go through the trunk. So let's trace it down. Okay. So you've got preganglionic fiber here in this image. It has green color, dark green color, bright green color. Can you see that? So it leaves lateral horn through the ventral root, okay, and then enters so-called white rami communicans. To make sense of it, let's talk about each word in that name in the white rami communicans separately. White, from anatomy physiology standpoint, what does it point at? If the nerve structure is white, it has what? It's axon, and it's what? Myelinated axon. Does that make sense? What is RAMI? What is the normal people's word for RAMI or RAMUS? RAMUS is singular, RAMI is plural. Do you remember? It starts with B. That's normal word. Remember, in spinal nerves we talked about dorsal rami and ventral rami. Starts with BR. Branch. Does that make sense? So it's myelinated branch. And what do you think communicans mean? Communication, exactly. So essentially it's a small branch that provides communication between the spinal nerve and the sympathetic trunk. Does that make sense to you? It's a small myelinated branch that provides the communication between the spinal nerve and sympathetic trunk. Now, let's go back to the picture on the right. Pre-ganglionic fiber, pre-ganglionic neuron, goes from the lateral horn through the spinal nerve to the sympathetic trunk, all at the same level. Does that make sense? It doesn't change the levels. Can it synapse there? Sure. Yeah, sure. Why not? You can just see that's the synapse right here. Does that make sense? And then after that synapse, post-ganglionic fiber, you can see it here in the like very kind of muted kind of green color. Okay? It goes to wherever. Does that make sense? When it leaves the sympathetic trunk, it leaves through so-called gray rami communicants. So it enters sympathetic trunk through white, it leaves through gray. What does that mean that it's gray rami communicants? It's actually still axons, but they are non-myelinated. Okay. Let me talk about like different levels of synapsing, and I will give you an analogy. Right? Option number 2. The pre-ganglionic fiber enters the sympathetic trunk at one level, then it goes up or down. Okay? Doesn't really matter. And then synapses at the different level. Does it make sense? So, pre-ganglionic fiber enters the sympathetic trunk at one level and then goes up and synapses at the different level. So again? Well, any given neuron will do only one. Does that make sense? But some neurons synapse at the same level, some neurons go up or down. Does that make sense? Let me go back for a second. Look at this. You can have the preganglionic fiber from T1 going all the way up to the cervical region. Say it one more time. Yep, it goes exactly. That's actually a great point. The preganglionic fiber goes synapses in the cervical ganglion because it innervates something in the head. Does that make sense? I usually give it the comparison, imagine that you have like a parking lot in a building, and on each floor there is a walkway from parking lot to the building. You can just park on the third level, go to the walkway, and get into the building. So it's synapsing at the same level. Or you can go to the elevator, get from the third level to sixth, and go directly where you need. Does that make sense? So preganglionic and postganglionic fibers can synapse at the same level in the sympathetic trunk or at the different level. Sympathetic can go up or down. Does that make sense? Awesome. There's third option. Preganglionic fiber bypasses the sympathetic trunk and goes all the way to so-called collateral ganglia, which are in the body periphery.
So essentially, like if somebody has damage to the spine, that's why their digestive tract can still work, even though their legs aren't working.
Great point. Yes. So essentially, what Jacques brought up, the great point. Think about this. You can have a person who has a damage to the spine, okay, at a certain level. It's like transection of the spine. So legs don't work. Say it's a damage in the lumbar region, okay? Legs don't work. But neurons that come from the higher level of the spinal cord, say from T8, thoracic 8 or thoracic 9, can still go through the collateral ganglia to the organs of the abdomen, say, digestive organs, and control them. Does that make sense? It's a great point that you brought it up. Okay? These neurons, preganglionic fibers, that leave spinal cord and go to the collateral ganglia form so-called splanchnic nerves. Okay? So before we move on, let's do like summary. First, preganglionic fibers in the sympathetic system are shorter than postganglionic, right? Second, when they leave the lateral horns of the spinal cord, they have three options. Option number 2, enter the sympathetic trunk through the white rami communicans and synapse with postganglionic fiber at the same level. Are we clear? Option number 2, enter the sympathetic trunk through the white rami communicans, go to the different level, up or down, and synapse with postganglionic fiber there. Option number 3, preganglionic fibers can bypass the sympathetic trunk, go to the periphery of the body and synapse with postganglionic fibers in collateral ganglia. Does it make sense? Postganglionic fibers, if the synapse is in the sympathetic trunk, will leave sympathetic trunk through the gray rami communicans, which means white rami are myelinated, gray rami are non-myelinated. Does that make sense? Sure, let's do it together. Preganglionic fibers of sympathetic nervous system originate in which structure of spinal cord? Preganglionic fibers of sympathetic nervous system originate in which structures of the spinal cord? Which horns? Lateral. That's unique. They are in the lateral. In which region of the spinal cord? Which anatomical region of the spinal cord? Huh? Not cervical. Originate. Originate. Thoracic and couple of lumbar. Does that make sense? Originate in thoracolumbar in the lateral horns. When they get out of the lateral horns via the ventral roots of spinal nerves, where do they go? The sympathetic trunk. Okay? What do they enter sympathetic trunk through? Rami, white, Rami, communicans. Once they enter the sympathetic trunk, what they can do there? Either synapse at the same level or synapse higher or lower with post-ganglionic neurons, which leave sympathetic trunk via gray Rami communicans. Those are two options, right? And then post-ganglionic will go all the way down to the organs. What is the third option for preganglionic fibers? To bypass the sympathetic trunk and synapse with post-ganglionic fibers in collateral ganglia. Is that better? Again, memorizing this like as the mnemonic, in my opinion, wouldn't work. You have to image this in your mind. You have to be able to sort of draw it. It doesn't have to be really pretty or artistic, but you have to be able to do sort of a flowchart scheme. Does that make sense? Preganglionic fibers, upper thoracic, head. Okay? Skin and blood vessels in the head. Dilator pupillae. What do you think dilator pupillae does? Dilates your pupils. It's actually lovely. I like that's one of the few cases when the name actually matches the function. Well, in muscles it's true, but you know, dilator pupillae dilates the pupil because when you are excited, your pupils get dilated. You need as much light in your eyes as possible. Does that make sense? Nasal and salivary glands are inhibited. When you have a runny nose, do you take any drugs? Sometimes, right? Like this. Well, antihistamines will work if you have an allergy, but what if you just have runny nose? I mean, and say, I'm an instructor. Talking to you with a runny nose, it's awful, okay? So I'm going to take a drug. Do you know there's anti-runny nose drugs? What do they contain? Never read? Phenylephrine. Yeah, because it's the analog of adrenaline. Seriously, phenylephrine is a modification of norepinephrine. So when you take this, what happens to the blood vessels? They constrict, so you produce simply less mucus. It doesn't cure it, just reduces the symptoms. It inhibits your nasal glands. Essentially, that phenylephrine in the drug, it imitates the sympathetic activity. Does that make sense? Okay. Same goes for salivary glands. We talked about salivation. Salivary glands getting inhibited, it means that blood flow to the salivary glands goes down, so you produce thick mucus. That make sense? Tarsal glands, we didn't talk about tarsal glands. Stimulation of tarsal glands produces more tarsal secretion, oily secretion that lubricates your eyes. And heart. Some branches go to the heart. You can see it here, okay? From the superior cervical ganglion, some branches go to the heart, okay? First half of the thoracic region of the spinal cord. Middle and inferior ganglia, skin, heart, aorta, thyroid, pretty much thoracic organs, okay? Does that make sense? Sympathetic stimulation to the heart. What does it do to the heart? Increases heart rate and? Say again? Not the rate. The force of contraction. Yes, it increases contractility. What does it do to the lungs? Lungs don't have muscles. So, I mean, your deeper breathing comes from skeletal muscles. Well, I shouldn't say lungs. What do they do to the bronchi in your lungs? Bronchodilation. And bronchodilation means, in terms of smooth muscle activity, what does that mean? Relaxation. Relaxation of smooth muscles of bronchi. Does that make sense? So cardiac muscle increases the contraction. Smooth muscles in the bronchi reduce the contraction. They relax. Does that make sense? What do you think happens to thyroid gland? We didn't talk about endocrine system. It gets stimulated. Okay, so you produce more thyroid hormone. You increase your metabolic rate. Okay? That make sense? Abdomen. So these nerves, they go to the abdomen and they form several splanchnic nerves. Greater, lesser splanchnic nerves that go through several ganglia. Now, name of the ganglia tells you exactly what gets innervated through that ganglia. Celiac ganglion, liver, stomach, spleen. Okay? Superior mesenteric ganglion, small intestine. Inferior mesenteric ganglion, large intestine. That make sense? Now let's talk about the activities. Celiac and superior mesenteric ganglia innervate stomach. What's going to happen to your stomach activity when you're excited? It's going to go down. Yeah. So smooth muscles of your stomach are going to get depressed, well, relaxed. Okay? And glands in your stomach will not produce as much gastric juice. Okay? Same goes for intestines. What about the liver? When you are like really excited. When you exercise, come on, exercise is the easiest. When you exercise, what's going to happen to your liver? It's going to release something, some chemical in the blood that you need when you exercise. Some nutrient will go into your blood from your liver when you exercise. Huh? You're overthinking. Nutrient will go from liver to your blood. It's needed for cellular respiration. Say again? Glucose. Glucose, yep. Glucose. Glycogen will get broken down and glucose will be released. Does that make sense? Kidneys. What is the function of kidneys? And produce urine. What's going to happen to kidneys if you're like really excited, like you exercise heavy? They're going to slow down. They're not going to filter as much. Well, I mean, they're going to filter as much. They're going to try to conserve water, okay, and will not produce as much urine. And spleen probably will start to produce clotting factors. If you get injured, you know, your blood clots better. Bladder. It's going to hold urine. Actually, if you exercise for a long time, you may notice sometimes you may enter the gym or you start running and you kind of feel, maybe I should go pee. And you run for a long time and you're fine. And then you finish, and the moment you step into your house, you think, holy crap, I need to go to the restroom, like right now, like immediately, because sympathetic activation goes away. Parasympathetic kicks in, and now you need to get rid of all that urine. Okay, because the activity of smooth muscles of the urinary bladder was depressed. Does that make sense? Large intestine will be mostly inhibited. As a runner, I may tell you, it doesn't work that well all the time. Sometimes you just have to find the toilet. Reproductive organs. That's interesting. So generally, activity of reproductive organs is inhibited. Blood vessels that go to reproductive organs are constricted, okay, during exercise. So it's unlikely to get an erection. But when the reproductive function is actually needed, so during, say, sexual intercourse, then the sympathetic stimulation in reproductive organs of a male is responsible for the ejaculation, semen expulsion. It's a contraction of smooth muscles. In female, it's responsible for vaginal contractions that will help the sperm to get through the uterus into the fallopian tubes. Okay, we'll talk about, that's actually a very interesting phenomenon when sympathetic and parasympathetic responses in reproductive organs, they work together to ensure that reproduction actually happens. We're not going to talk about adrenal medulla now because we're out of time. Please remind me that we stopped at adrenal medulla because that's really fascinating. Okay? Those of you who didn't take the quiz and the scantron. Exams Thursday, yes.